where I might go back to that question. But question 8 is in around what are the most recent developments in your area or specialty. So in answering question 8, the most recent sort of major developments in the specialty are aligned to the use of different apps or app technology, some aspects in around app technology to better or smarter the care of kidney in around kidney care services for healthcare service users, and also aligned to where health professionals and healthcare service users can utilize sort of app technology in a more streamlined way, aligned to seeing that particular apps are interlinked with patient or health patient records or healthcare records. That being said, there is still fragmentation in around aspects of those advances in within the specialty. So, for example, whilst there have been fantastic works and advancing works in around for example, where there was patient view or renal patient view as it was once known, that allows which is an electronic patient record service that allows healthcare service users to access their healthcare data at their own leisure, leisure or time. At the same time, that being said, the issues around a patient view or renal patient view is that not all NHS trusts, not all national health service trusts that have kidney services have healthcare service users on patient view, and in more recent years, patient view has actually been interlinked with another sort of electronic patient record to see a sense of continuum in where healthcare service users can access their clinical data, if you will, or lab data at their own leisure, with that service being PKB, or patient knows best. So there have been advances in around that, and there have been advances in around other sort of technologies, other sort of technologies in around kidney care services, but in the efforts that there have been, whilst there have been really humble efforts and advancing efforts, the challenges have been that there's still fragmentation or segregation in the way some of the tech or even some of the healthcare services or kidney care services have been sort of currently sort of exist. So there have been advances in that, and there have been advances in sort of bettering the educational services in some regard, but those that have been evidence or literature, they are in amongst the literature, they have been successful based on where there's been co-development in around healthcare service provider and healthcare service user co-developing workshops to see a sort of a sense of bridging healthcare services, and not so much as in aligned to healthcare services which actually are linked to advances where healthcare service users can actually use sort of or implement educational services in as part of their clinical the clinical or even their lab sort of investigations.